Symptoms of angina, how it can feel like pressure, tightness, squeezing, pain, a dull ache. You'll usually feel angina in your chest. When to get help? If you have chest pain, symptoms of angina can feel similar to symptoms of a heart attack. It can be difficult to know when to get help. If you're unsure, call 999 for an ambulance. What is angina? Angina is the name for chest pain, or an uncomfortable feeling that happens when blood flow to your heart muscle is reduced. You might also feel pain or a painful sensation in your front, back, shoulders, stomach, arms, jaw, or neck. What causes angina? The most common cause of angina is coronary heart disease, CHD. This is when the arteries that supply your heart muscle with blood and oxygen are narrowed by a fatty substance called plaque, atheroma. Your risk of developing time? Coronary heart disease is increased by smoking, diabetes, high cholesterol, high blood pressure, hypertension, having excess weight, or obesity, having a family history of CHD, age. The older you are, the more likely you are to get CHG. It usually lasts 5 minutes or less and gets better, or goes away if you rest or take medicine. What are the different types of angina? The main types of angina are stable, unstable, vasospastic, microvascular, refractory. What does angina feel like? Angina can feel different for everyone. It usually feels like pressure, tightness, or squeezing. This can feel painful or like a dull ache. You'll usually feel angina in your chest, but you can also feel it in your jaw, shoulders, arms, stomach, neck, back. You may also feel tired, dizzy, sweaty, sick, breathless. How will I know if the pain is angina? Angina may happen during or shortly after certain activities. Physical activity because your heart needs to pump harder to keep up with what you're doing. Emotional stress can trigger a rush of hormones that can narrow the arteries. Cold weather because it takes away your body heat, so your heart needs to work harder. When should I ask for medical help? It can be difficult to know when to get help, especially when you're first diagnosed with angina. Call 999 if chest pain comes on suddenly, and does not stop after a few minutes of rest because you could be having a heart attack. How is angina diagnosed? If you see a GP, they may ask about your symptoms, what you were doing when the symptoms started, your lifestyle, such as your diet, and if you smoke or drink, your family medical history. To help your doctor diagnose your pain, keep a record of when and where you have pain, what it feels like, how long it lasts, if anything made it feel better. Or worse, what if I have to wait for a referral appointment? It can take a while to get a hospital appointment, possibly weeks or months. It can also take up to a few weeks to get your test results. Many people feel worried or anxious during this time. There is no right or wrong way to deal with these feelings, and everyone is different. How do I come to terms with my diagnosis? Many people have good days and bad days following a diagnosis. It can be stressful, and it's normal to feel anxious or sad. Having angina pain can also be scary, and you might worry about it happening again. It's important to remember that taking your medicine and making lifestyle changes gives you the best chance of living well with angina. What's the treatment for angina? Most people with angina need to take medicines every day. Surgery or other procedures, such as a stent, may be recommended if medicines are not helping. It's important to make healthy lifestyle changes too. Treatment for angina helps to manage pain or any uncomfortable feelings and reduce the risk of a heart attack or stroke. Medicines.